So I personally found in my clinical experience that we have a very large need in our area for education regarding postpartum care related to pelvic floor dysfunction, core dysfunction, and other issues that many women may not know can arise after having a baby, whether it be your first child, your second child, or your third child. I've seen it many times with my patient caseload that a lot of them have had these needs for maybe years, and it has never properly been addressed.
Well, as far as being the wellness coordinator for St. Mary's, we always try to promote resources to the community, especially resources that are not really available anywhere else for an underserved population, which this definitely is. A lot of women really have no idea that these resources are even available. They think a lot of the problems are just normal, and that's something they should just adjust to. And so we really wanted to try to bring awareness with this class to let participants know that this is something that they don't have to get used to. There is help available, and so as well as being an athletic trainer, I can step in and help with the exercises and things that we do and demonstrate in the classes, and so I think it really helps a lot of people that can come take advantage of that.
So pelvic floor dysfunction consists of a variety of things. A lot of times pelvic floor dysfunction stems from the pelvic floor muscles not working correctly. And that can lead to bladder control issues, it can lead to bowel control issues, it can lead to pain with intercourse, sexual dysfunction. A lot of times people have issues with heightened urinary urgency, feeling like they need to go to the bathroom often, or totally opposite, where they can't control their bladder and they have a lot of issues with leakage and things of that nature as well. So.
Knowing that that's something that, yes, those problems can occur. It is normal for those things to happen, but that it's not normal for you to have to live with them forever. That there are resources and tools available, there are treatments available, things that you can do that will help improve your quality of life and make things easier so that you don't have to just adjust to that and think that that's how you have to live the rest of your life. So that is really important that we want people to know that those resources are available.
So first line of action that we usually try to do is educate women. Provide education on issues related to pregnancy and postpartum care. A lot of times that incorporates pelvic floor dysfunction issues, pelvic floor weakness, scar tissue management that may occur whether you've had a C-section or a natural delivery. We educate you on bladder control, bowel dysfunction issues, sexual dysfunction, and then also prevention. A lot of ways, how can we keep you from having those issues, whether it be current or in the future. We
do hands-on demonstrations with a lot of the exercises that address some of the issues that Shauna was just discussing, and we actually allow participants to do those in the workshop so that they can actually do them with us. We can watch what they're doing and instruct them if there's something that they need to correct so that they feel comfortable doing them at home, since they've actually been able to practice them basically there with us in the workshop. And so there are a lot of exercises that people, I think, don't really realize that normally it would be completely safe, but with some of the issues, especially during pregnancy and things like that, some complications you can have that Shauna mentioned, there's some exercises that maybe you need to steer away from that people may not really realize that. So we're there to instruct them, to show them what is safe, what is not, what are some things that you should definitely be doing, and what are some things that you should avoid.
I just think it's really therapeutic, even as a therapist, to see women leave and feel empowered, to know that they can take control of these issues, that they don't have to live with them for the rest of their life, and that there are things that can be done, whether it's education, seeing a therapist such as myself, or just doing some home exercise program for prevention or for proper treatment of these conditions. Also, just giving proper guidance to women, for me, is very rewarding as a therapist, because I think a lot of women leave there feeling like, okay, now I do know what I can do to help make these situations better for myself, and I'm not alone. There's other women out there dealing with these issues as well.
And definitely them knowing that, okay, it's not just me.
Yeah, sure.
This is something that other people are experiencing. I think that's something that's really important that a lot of people get out of the class. A lot of times the women that are in the class kind of talk to each other, and so they're able to swap stories and kind of talk about their experiences and then share those with others, other friends they may have that may be going through the same thing. And so I think that's really important, kind of the networking and connection there that they're able to receive, not only with us but also with each other, and then to pass that on as well.